Hi, I'm Vivian Vasallo, the Executive Director of the Delta Dental Institute. And today for our conversation on community impact, I'm joined by two of my colleagues in the Delta Dental system. My colleague, Karis Stoudamire-Phillips, is with Delta Dental of Oregon and Alaska. She is the Vice President of Diversity, Equity, and Inclusion and Community Impact. I'm also joined by my colleague, Adeeb Khan from Delta Dental of Colorado. Adeeb is the Vice President for Corporate Social Responsibility at Delta Dental of Colorado and the Executive Director of the Delta Dental of Colorado Foundation. Thank you both for joining us. We have just released our 2020 Community Impact Report for Delta Dental, where we tell the national story of all of the great work that we've been doing in the communities across the country. This report shares our commitment to our communities, as well as how we have been responsive to the COVID-19 pandemic and the health disparities that exist in our country. As we kick off the conversation series, I'd like to ask how each of you responded to last year. What changes or adjustments did you make? And we'll start there.
Yes, thank you for having me here today. We absolutely did have to change. Everyone, I don't want to use the word pivot because that's the word of 2020, right? But we did. And what we really realized is that a lot of our work was with youth, and youth were impacted in a way not by contracting COVID, but youth were not able to do their normal activities, right? So they were unable to go to school. They were unable to go to their after school activities and places where we actually provided service. So for our dental services that we typically would provide for children, we couldn't get to them. And so that was something that we really had to adjust to and figure out ways that we could still provide services and be impactful to get those needed things to young people. So that was one of the biggest things that really shut us down initially, I think. And then we just had to really be creative on how are we still going to get our resources and our services to communities and children that really needed them. Another way that I feel like we really had to change is that we support and we sponsor a lot of events and programs that couldn't take place or they could not take place in person. But we still wanted to be able to support, financially support, and with in-kind support to those organizations, even if they were not able to gather and meet for their event or gather and meet for their actual programs, because the people that they are serving still needed those services. So we were very, very deliberate in making sure that we did not cease any of our services and as far as any of our financial gifts. We made sure that we were still not decreasing any of those gifts and that we were not ceasing to give any of those gifts. And so I think it was really important for us to do that. And it really meant a lot to our partners that they still had us as partners there to support them during those difficult times.
Adeeb?
Yeah, I mean, obviously 2020 was just unprecedented in a lot of ways for us, whether that's as an individual or as an organization. And so it required us to, make strategic shifts without a lot of data and try and understand ways that we can kind of create impact and help and support our organizations, many of which were frontline clinics, FQHCs, across the state of Colorado that were kind of dealing with a number of different effects. And then on top of all of that, when the pandemic first hit, oral health care as a whole essentially got shut down for about 12 weeks. And so when you conflate the pandemic, the stock market crash, oral health care getting shut down, and the needs of our community rising exponentially, all of those things forced us to try and take some action. The first thing we did was essentially with all of our grantees was remove any of the reporting requirements that we had for that time period. We advanced about $1 million of funding, which was originally scheduled to be paid out in December of last year. We moved those payments up into April just to provide more financial flexibility for our organizations that we supported. And then we really thought about what is our response going to be to the community. We both had to look after our oral health organizations, our providers across the state who now didn't have any business coming in. And we also had to reach out and help the community. So we created at Delta Dental Colorado a $30 million comprehensive response plan. Part of that was focused on providing low interest loans to oral health providers. we were able to really help out a number of providers across the state, especially new providers who had just really started their practice with some of that funding through the low interest loans. We launched a $2 million COVID relief fund through the foundation, and that was meant to support wraparound services for organizations throughout the state of Colorado. And through that funding, we supported about 54 of the 64 counties in the state of Colorado. So we were really able to spread dollars around the state. We also did a $3 million of PPE disbursement and coverage for our providers so that they could take on some of the new requirements with the equipment. And then finally, we had about a $16 million payback to our groups, our employers around the state, because there was no oral health services happening between April and May. And so we gave that money back. And that was also something that was really well received by a number, especially our small businesses, who it made a big difference for. And so, launching all of that, executing it, this is the first time we've ever done a loan fund before. This was the first time we ever did a COVID relief fund in this, a specific kind of relief fund like this. And we were funding different agencies, not for oral health, but just for general support in the community. So it took a lot of learning, but our team, they pivoted to kind of, we use the word of 2020, and I feel really great about what our organization was able to achieve and how we responded and how we did kind of step up in a time when our community needed it most.
That's both great examples of how organizations were able to adapt, and it sounds like both of you were really in tune with the needs of the community and your community partners and responding to what they needed, especially at that point in time. I'm curious, what learnings do you have? What have you heard from community partners? What do you think you might keep that you did in 2020 going forward in your support of community or your engagement with community partners?
Yeah, I mean, in terms of what we learned, there's a ton of learnings. And I think, I could speak to so many of them. One of them that comes to mind, just because it's a continuing conversation, is the importance of childcare and how that affects everybody in so many different ways, and their ability to work, and they're also the ability for their kids to have a safe, quality place to learn and grow. And so when we talk about kind of looking at bringing our team members back to the office, when we talk about the struggles that a lot of people are facing around the state, one of those issues is childcare. And so it's one of those things where we have to think maybe differently about how we support that work in the future, both as a foundation and as a company. But we've learned so much just in terms of how valuable our community organizations are and how pivotal of a role that they play, and how we as a foundation, because we touch so many people as a company across the state of Colorado, and we have so many clients, it's important for us to be present and to be, leading some of this work. One of the other things we did last year was we funded and volunteered for the governor of Colorado's state COVID relief fund. That fund ended up distributing about $25 million in grants to nonprofits across the state. And through that process, I learned about so many new organizations that were embedded in communities, trusted in communities. And for me, I want to really start to look outside of kind of the normal organizations that we've worked with in the past, and really start to focus on how we can gain a better relationship and access to some of these community organizations that aren't used to the traditional ways of working with foundations and going through philanthropy. So those organizations, many of them we funded through the state fund, have built and established a lot of trust in their communities. And it's important for us to work with those organizations and hopefully bring more oral health resources to the communities they serve.
Okay. And Karis?
What we did learn, I will say, is everyone, the health inequities, across the board in how people have access to dental health, medical health, pharmacy health, mental health. I think one of our largest takeaways was, and I'm seeing that everyone will probably be nodding their head with this, is that mental health is what really took a toll during this time. And so if your mental health is not stable, then you're not worried about any of your other it's your hierarchy of needs. So when we saw that, as we said, that dental health just was completely closed down. And so the preventative care for both dental and medical just went by the wayside. And so what we've really now been doing is really trying to get people back into their dentist office, back into their doctor's offices, back into their behavioral mental health doctor's offices, and getting back on track with the things that they need to survive. So that is something that we have really seen and really targeted and tried to partner with our community partners, with our provider community, and even with our legislative community here in both Oregon and Alaska. That was just something that we had not always been, I would say, called on to do. We had legislative partners and relationships, but really had to utilize those during this time and to make sure that voices were being heard and that the things that the community needed was being heard. So I think that gave us an opportunity that we maybe had not taken advantage of so much in the past, but really utilizing that opportunity to get voices heard of people in the community and what they actually needed. And then now that preventative side of really getting people back on, as I said, back on track with their needs.
Yeah, Karis, you touched on two issues. One, we talk about medical dental integration in healthcare and how oral health is essential to overall health. And we heard that as people were going back to the dentist, the issues they were having were teeth grinding, chipped teeth. The stress was really playing out through their oral health. And so those connections, we see that as an example of demonstrating that. The other issue which I wanted to ask you a little bit more about is health equity. You have in your title the Vice President of Diversity, Equity, and Inclusion. And so I'm curious if you can share with us a little bit more about how that position was created at Delta Dental of Oregon and Alaska, and what it is and how that connects to the work that you're doing and to pursue health equity.
Absolutely. So initially, my title was Corporate Social Responsibility Director, and we established a diversity council at MOTA back in 2016 that I helped to establish, and I still help to lead that group. And with that, we just really took a deep dive at looking across the organization to see what were we doing well in DEI and what were we not doing well. And so the areas that we really focused in on are our language access, our vendor diversity, our recruitment and retention. And then also looking at our provider diversity, our member diversity. How are we serving the needs of our providers? How are we serving the needs of our members adequately? And when I was in the role of Corporate Social Responsibility Director, the three areas that we gave in, and we still give in, are health, environment, and social equity. Initially, it was just health and environment. And when I came into that role, I really started looking to see, where are we actually giving? Are we really giving in just health and environment? But kind of, following that check trail, and got to see that we were actually doing a lot of work in the area of social equity, but we weren't really calling it out. It wasn't one of our pillars. And so adding that as one of our pillars, I think it was really important for us to do that, because then it let the community know that we are interested in anything that you are doing that involves social equity. We want to be your partner. We want to partner with you. So that is something that we, when we established that, I wouldn't say people came in droves, but it really opened us up and gave us a better understanding of community, a better connection to community. And I think it really deepened our relationships with with some of the organizations that we were already working with, because then they were able to tell us what they were doing. We may have been supporting them because of health or supporting them because of environment, but now they were able to really emphasize what they were doing in the area of social equity, because they knew that that was an interest of ours and an interest of theirs. So I think I was kind of doing it organically. It wasn't a part of what we were doing initially. I was seeking out those type of organizations just on a personal level, because I thought that it was important. And I knew that it was important for us to be serving disadvantaged communities, communities of color, LGBTQIA communities, veterans communities, and just making sure that they knew that MOTA could be their partner. And I think it also really invigorated employees, because employees who cared about those communities or were members of those communities then saw their employer as an employer of choice, an employer that they could connect with, an employer they could be proud to work for. And so that Diversity Council continues to grow. We have employee resource groups. We now have many committees across the company that are really focused in on DEI initiatives, because we want to make sure that, like I said, in every aspect of everything that we do, whether it's an ad on television, whether it's a print ad, whether it's how we are showing up at an event. If we have a booth or something at an event, how are we showing up? Are we making sure that we are accessible to the community that's there? Do we have the right languages available for them to take material from us? It's just all of those things, and making sure that we're actually thinking about them in real time, and making sure that we are being that partner, that we are being accessible. So that it really excites me, that the opportunity to merge those two things. I mean, DEI and community engagement, community impact, and community initiatives are my passions. And so to have the opportunity to really cross over with both of those and help to move our company forward and partner with community partners, partner with my colleagues, is just been very exciting. And I think that our company as a whole has just been so all in that everyone feels it. And we even I hear from people in HR as they're interviewing, that someone will say, well, I looked and I saw your DEI statement on your website, and that's what drew me to the organization. So it's important, and it's real. So I think that when you're authentic, then people will gravitate.
Yeah, that's a great example, and certainly an inspiration to all of us at Delta Dental, and I think really speaks to our purpose, our mission, being a mission-driven organization. And you touched on several examples of why it's important to be respectful of your partners, for your employees, your customers. It really is a very inclusive strategy across the board, and it sounds like you're all doing a great job in helping to achieve that, not only in the organization, but to really drive to greater health equity. Adeeb, I'm curious what you are all doing in Colorado, and how response to some of the events last year that really surfaced and amplified issues that most of us in public health and community development are aware of, but really underscored how much more we still have to do. Can you share with us some of the things that you're thinking about and doing and talking about in Colorado?
Yeah, happy to. I started last January. I started this position, and part of it was to help the company really develop an inclusion and diversity strategy. With regards to the foundation, we had already established oral health equity as part of our mission statement in 2018. And so the organization had definitely taken some steps with some outside consultants to really reevaluate our work and look at how we can be addressing the issues of equity as it pertains to health, because they're absolutely connected. But with the incidents around the murder of George Floyd, and all of the protests, I think ultimately all that did for us was really just accelerate our process and make it more of a priority. I think originally we were thinking it was something we were going to really start to launch maybe perhaps at the beginning of 2021, but our conclusion was that this is not something that really should be waiting at all. It's something that as a company we really needed to start. So we brought in a consultant, and we've had the ability to stand up an Inclusion and Diversity Council. That council is meeting every 2 weeks and has been since January. They've already created a mission and a vision for us. And one of the things we completed earlier this spring was an organizational assessment to really understand from a baseline standpoint of a lot of the beliefs, feelings, opinions of our culture and our people, and what that reveals to us in terms of both really great things that make up our culture and areas that we can continue to work on. In fact, right after this call, we've got a 2-hour training with our I&D council, and I'm really looking forward to it. It's geared around courageous conversations. And I think so much of the work that we're focusing on is that, when we talk about the idea of inclusivity, the history of our country is one that has been so exclusive in so many different ways, and it's based those on race, and it's based those on ethnicity, and people have suffered dramatically as a result of that. And what we've never really created, I think, as a society as a whole, is a safe way to talk about that, and a safe way to really bring those issues to light, because while for some people those issues may not be a huge part of their day-to-day reality, for others it is a very significant part. And when we can create a culture where it's safe to be able to talk about those things, it's safe to be able to acknowledge some of the horrible situations that our country has put people in, and that we have some collective growth to do. That's what, to Karis was saying earlier, that's what makes people proud to work here. That's what makes people want to come work here. And so that's the culture we're trying to foster. And on the foundation side, we're looking at it essentially as a 10-year initiative. But oral health care is not diversely represented, especially at the higher levels like the hygienist and dentist positions. If you look at assistant positions, there's actually majority minority population here in Colorado. So the higher the paying the job, the higher percentage of white people representing. And if you look at dentists, it's over 90% of all dentists here in Colorado are white. So, understanding workforce pipeline development work, we can understand why historical racism has probably led to those numbers. And so we're trying to create a long-term strategy through scholarships, through building a pipeline at a high school, we're exploring career impact bonds as another opportunity to get the most bang for our buck. And so we're really looking at a number of different strategies, but the goal of it is to create more opportunities for BIPOC populations in Colorado to have access to careers in oral health, because that's not only a way for economic prosperity for maybe people who haven't had those opportunities as much, but it's also an opportunity to create more cohesion, especially racial cohesion in the oral healthcare workforce, which is better for serving the clients that we're trying to reach anyway. And so a lot of different things happening beyond that, but those are kind of two of the big ones, one from the foundation and one from the company that we're really focused on right now.
Great. I always learn so much. Go ahead, Karis.
Oh, I have to jump in there. I'm so glad that you said that about the exposure to dental careers and that opportunity just to get more people of color in that pipeline. And that's something that we also have the opportunity to take the time to have those conversations this year as we started looking at our provider panels and seeing that, okay, there's not a lot of diversity as we're looking at our dental panel of providers across the states of both Alaska and Oregon. And so looking to partner with some of our dental schools locally to figure out, okay, at what age do kids actually start thinking about careers? So that's when we need to have that intervention of getting them exposed to dental careers, medical careers, pharmacy careers, anything in the medical health field. So I love that you all are doing that. It's something that we're looking to do too, get that exposure early and just get kids start thinking that this is something that I can do.
Mm-hmm.
Absolutely. I was going to say, I always learn so much when I hear my colleagues across the system speak, and I think this is one of the areas where the system is very much engaged in giving. As you'll see in our community impact report, oral health education is an area that's been very strong for Delta Dental, and now taking a look at the pipeline in this oral health diversity workforce and how can we contribute to that conversation. There are a few, what I would say, levers that we can use for community impact: corporate giving, grant making, our organizational culture. We talk about different vehicles like community impact bonds and investment opportunities. Another area that we can use to bring about and change in communities and more health equity is advocacy. And so sometimes nonprofits or foundations shy away from that. But it is a tool that we can use. And so I would appreciate if you could share with us how each of you approach advocacy, either at a local level, at a state level. We certainly do that at the Delta Dental Institute at a national and federal level. So I'm curious to hear what you're doing in your communities to engage, to use that avenue as well.
Sure. For us, I started back in January, but I think we were focused from really what we're building with our foundation to create a much stronger policy and advocacy component to our work. In fact, it's really the end goal of most of our work. We're building kind of some new enhancements around data gathering and evaluation, and really the goal of that is to help inform policy work for the future. So we really want to kind of identify ways that we can make strategic grants that will have quality data to prove concepts that we can then take into the policy world. And so there's a number of ways we've approached it. This past year, We've testified on a number of bills, both with the hygienist scope of practice. The benefits for dental were reduced during COVID, and we advocated to get those benefits back to where they were pre-COVID, and we were able to be successful in that work. We also supported and testified for the teledentistry bill, which also passed here in Colorado. And I've actually gotten really involved testifying on behalf of a new opportunity to create a Department of Early Childhood here in the state of Colorado, which would focus both kind of early childhood care and education with health services in one new department, kind of for that 0 to 5 age group. And we see that as a really good opportunity for us to create new programming around prevention that is designed for early childhood and can integrate oral health care practice into early childhood care settings. Again, with everything we're looking at, we're always thinking about how can we use this grant? How can we use this data? How can we use these partnerships to hopefully get to us to create long-term policy change? Because the reality is our dollars only go so far. And I think we all understand the impact that we can have by directing federal and state tax dollars to the right programs. And so that's really for us, we're kind of shifting our strategy this last year. And kind of we're going to be bringing on some policy staff. So we really do see that as our future is to be much more involved in policy around oral health, to be really strong in our data so that we can speak as an expert, and to be able to identify best practices from not only around the country, but even around the world that other countries have implemented around oral health that we can implement here in Colorado. So it's a big part of our work. And once you start getting involved, you kind of it's interesting to navigate between what the foundation really wants to go out and support and yet what the company maybe wants to stay neutral on. So there's always going to be some conflict that exists there. I think what's great about Delta Dental of Colorado is we've decided we're going to be comfortable in a space where there is some conflict because we're going to really allow both organizations to fulfill their mission and pursue their mission. And that makes us stronger as a whole unit. And I agree with that. And I think that's been great.
Yeah, I also heard in there, Adeeb, a lot of underlying connections to various areas. So as we say, oral health is essential to overall health. You're partnering with different healthcare organizations in your state and working with health foundations and also with partners working in education and community, right? So really helping others understand the importance of oral health, but you're also doing that as part of these broader coalitions to advance our issue in a broader perspective.
Yeah, I think, there's the policy side of it. And then when you kind of speak to some of the advocacy components and that integration within overall health and really establishing that. And it's always going to be kind of an ongoing battle for oral health because we're not in the limelight. I think a lot of us realize that people don't think of oral health sometimes as like an immediate basic need. But the reality is when you start to kind of look at the data and study it and understand the connections to overall health, that we probably need to do a better job of highlighting how oral health really impacts so much of overall health. And that's an opportunity for us. And so, it's definitely going to be part of what we try to bring about going forward. But I would say that as an organization, part of our strategy is to move back a little bit from just kind of trying to do public education and public awareness, and instead real kind of think about using those resources differently from a changing kind of policy focus. So that's kind of where we're at right now.
Yeah, that's great. And Karis, I'm curious to hear your answer because you're one of our member companies that has a lot of integration with medical and dental in a way that's different from some of the other Delta dental organizations. So I'd love to hear how you are all also addressing policy and advocacy and how you're seeing those connections as part of broader overall healthcare conversations in your region.
Yes, so I will say that our lobbyists in Oregon are extremely busy. They have been they're always busy, but this past year they were even more busy. As bills are coming forward, they usually share them out directly. We have a team of lobbyists that work with us and report up to our government relations team. And so they share with us what's coming out, what's out there, what things should we, we have conversations about what things we need to get behind and what things we need to support. And so there was a lot of work this past year. One of the big things that we were involved in initially was actually when dentist offices were wanting to reopen. So that was something that our government relations team, and you all know Dr. Terry Barrichello, who was very instrumental in advocating on behalf of dentists to get offices reopened and also to get PPE, the necessary PPE to those dentists. And so that was a very large project that we worked on with the state government. But yes, that is something that I'm just trying to even think of all of the different bills that I see come across my email that we're asking for, writing letters. I've written many letters of support representing MODA and representing Delta Dental, representing our other subsidiaries and areas of pharmacy. We do quite a, have all of those things intertwined. And so it's very important for us to definitely have a team that's really devoted to that work, and then call on the experts and leaders throughout the company to help to push forward those agendas when those times come. So that is something that we are known for in the state of Oregon and also in Alaska, as being very, very intricately engaged in a government process and what's going to help to promote the initiatives that we have on both the dental and the medical side. So I would also say our providers really look to us for that advocacy support as well. Our hospital partners as well, clinic partners, if they have an initiative, they know that they can come to us and garner that support in the legislature.
It's quite a tapestry of work that we do, and it's not easy work, but it's great to hear both of your stories and your examples of what's going on in your communities, reflecting on 2020, taking those lessons and integrating them into moving forward. As we begin to close our conversation series, as you think about final thoughts to share around oral health as part of overall health, and how we, I guess more broadly, you and others and all of us working together, how can we come together to champion more oral health as overall health? And what would be some words of wisdom that you might want to share with others who are watching this, who maybe aren't as familiar with oral health and aren't thinking about that as their community giving, or are not thinking about that as part of their healthcare advocacy? What are some words of wisdom and calls to action that you can leave our viewers with today?
Well, I mean, I'll just speak to it, because I've been really involved with the early childhood perspective in the last few months as we've been pushing this bill along. And what's been interesting for me is to see the data and also hear the stories of how so many kids in many of our kind of poor communities, really one of the things that COVID brought about is they had to bring their own snacks to school rather than the school providing snacks for everybody. And oftentimes my wife, who works in these settings, would say that the kids are just bringing, not really food, just like sugary, treats. And that was their daily snacks. And a lot of these same kids also didn't have great access to oral health care. And so they were in pain a lot from what they were dealing with on a daily basis. And so when we talk about kind of the overall care of these kids, it's not just focusing on oral health, but it's all the things that are coupled with it, from access to care, from being able to have screenings, from having nutritious food, and having support services that can reach them where they are. So can we do something in that classroom setting? And we know that, 30% of our kids entering kindergarten in the state of Colorado have cavities, and we have a lot of kids who are unable to learn as a result. And so when you talk about and more kids miss school for oral health care needs than anything else in the state of Colorado. So when you talk about all of these connections to the development of, really well-functioning human beings, oral health care plays a really critical role. And so we have to think about it broader, and we really just have to think about integration. How can we bring oral health care to people, or at least raise that awareness and being able to provide more access where they are? And I think that's going to be a challenge for us. Because many of the communities we're trying to reach That's the critical barrier that we're trying to overcome. And so it's going to be it's a long road, and we'll slowly, hopefully, make progress. But I do believe, Vivian, with your leadership here, as well as some of the new leadership at DDCO, I mean, we already, as a cohort of companies, are giving, the foundations alone gave more than $102 million to their communities in 2020, reaching almost 25 million people, on top of the company's commitment of over $1 billion during the pandemic. And so when you look at the size of the impact, there's opportunities for us to do things bigger together. And so I hope that in the years to come that we find some of those opportunities, and we're also able to find ways that we can put our resources together for real systems change, because that's the work I think that we all should be dedicated to.
Fantastic. Karis?
Yeah, so some wisdom to share. So for us, I would think that, of course, with youth, that's definitely, as Adeeb has really shared, that approach. But also say the social and social justice and racial justice when it comes to dental care and when it comes to medical care, and that access thing, that access point again, as we saw that people, as dental offices and medical offices closed, people were unable to go. But when you look at who is now returning, who is now making those appointments, seeing their doctors, seeing their dentists, the numbers are low in communities of color. The numbers are low in more disadvantaged, poorer communities. And so really that education piece of why it's important, I think that is a key area that we can all work on. And as we've talked about collectively, all of the Delta Dentals, I mean, that's something that I know that we do, but I think that right now, as we're coming out of the pandemic slowly here, that's something that we can really emphasize and partner with, is that educational piece of the why, the importance of the why, because those communities that it was not at the front of their thought process of what the care that they needed initially, now it's even lower on that list. And so as how we know a smile, your teeth, your oral health just affects so much of who you are as a person and how you engage, how you interact, and not having healthy dental care, and how that just really impacts. So I think that if we are able to really collaborate on that educational piece as we're coming out of this pandemic, as we're coming into new horizons, that is something that we can really help to benefit the community on.
Absolutely. We released a paper last year on this topic at the Institute, and we'll continue to move forward in both our research, community impact, and advocacy work. As our community impact report shares, our giving impacted the lives of almost 25 million people in our country in 2020, but we know that the need is still there, and this need is still great, and we need to continue to do more. And so we invite others that are in healthcare and in these adjacent sectors that we continue to work together. When you see the headline of the Community Impact Report, it's a big number, and that number comes from all of our member companies across the country working on these issues together. So we're very excited to share this report with all of you. We're very excited to have heard from two of our leaders in our Delta Dental system today, and invite you to visit our website, www.deltadental.com, where you can find our 2020 Community Impact Report, as well as our research and other efforts from the system, and connect to the stories and more like those that were shared today by Adeeb and Karis. So in closing, Adeeb and Karis, thank you so much for joining us. Thank you more for all of the great work that you're doing in your communities and for sharing those learnings, because it's so important to share these stories across the country so that others can learn and know they're not alone in the issues that they're tackling. So again, thank you for joining us. And for those of you watching, feel free to visit our website, www.deltadental.com, for more information. Thank you.